Hi, I'm Mike Bechtel, Vice President of Membership at Redirect Health, and I'm excited to talk to you today about the Redirect Health plans and how they can help your clients and their employees. So just a quick background on the agenda. We're going to go through the background. We're going to talk about products and solutions. How do we do it? Our care team. We'll go into the benefit summary so you understand the plans and why they're a little bit different. How we support you with technology, and then go over some frequently asked questions, and then what's next. So a little bit background of Redirect Health. So Redirect Health, this is the result of over 20 years of innovation, right? We started as a single healthcare clinic in 1997, and then Redirect Health was founded in 2014. And we quickly grew to be a real healthcare solution for businesses in all 50 states because we created a simple and affordable solution for everyone. Today, Redirect Health manages over 13,000 employees. We have medical and TPA licenses in all 50 states, and really it's a combination of technology and medical knowledge. So let me talk to you about how we started and where we are today. And this whole idea started with a mom with a medical degree. And this is Dr. Johnston, our Chief Medical Officer, her husband, Dr. Berg. They founded this idea and they came up with this healthcare solution. You can imagine the way that their kids accessed healthcare was much different than the way we do, where we have to take a card and put it on a counter and fill out forms. When her kids got sick, they just said, "Mom." And you can imagine the level of care was much better. The coordination, the navigation of getting them to visits was all done in just a very streamlined way. And then the follow-up that happened. And it's because of this intuitive nature of a mom with a medical degree. So the cool part of this is this company was founded by two doctors. Back in 1997, they created Arrowhead Health Centers. And that clinic grew to where we had a lot of employees, and much like a lot of your clients, we dealt with the issue of rising health insurance costs. And we knew we needed a new solution. And in 2008, we created Redirect Health for ourselves. And the idea was to make healthcare not just affordable on the premium side, but when we had to go use it, that would be affordable as well. So we started selling that idea to businesses in 2014, just here in Maricopa County in Arizona. By the end of 2015, we had about 2,000 members, and by 2017, we had members in all 50 states. In 2018, Arrowhead Health Centers, our clinical business, and Redirect Health, the healthcare business, we merged. And then in 2019, we had reached 10,000 members, again, in all 50 states. Now here we are in 2021. Again, we have our medical and TPA licenses in all 50 states. So here's the cool thing about these plans. Now, they're affordable. You can see the pricing here, but the unique pieces about this that are different than other plans. This is an ERISA insurance plan. Okay, so it's a self-funded ERISA insurance plan. It meets both the ACA rules for Penalty A and Penalty B, but the unique piece is there's no medical underwriting. And I'll tell you how we do that in just a second, but no medical underwriting for your employers. It's one fixed cost. You can see the pricing here. It's $379 per employee per month, $749 for employee spouse, $779 for employee children, and $1,099 for employee and family. Now, there's no participation percentage that's needed, but there is a minimum contribution, and that's $125 per employee per month. So that's a unique part about this. To meet the Penalty B, you do need to meet the minimum affordability at 9.83%. I'm going to get into some of these benefits in a minute, but the idea is a very affordable premium that allows the employer to take care of their employees. And we have care logistics. Now here's how this works. Redirect Health, we coordinate every aspect of our members' healthcare. We say, hey, reach out to us first, contact us first. Now this is not a call for permission or a call for authorization. It's really a call or a text or using our app to get care. We've made it really easy, and here's what it looks like. You're not feeling well, reach out to us first. Our care logistics team is available 24/7, English and Spanish. We are there to help our members. They're gonna collect some information. We have electronic medical records that they're gonna start to build the history. And then they're gonna hand that visit over to one of our medical providers who's going to execute a care plan. They're gonna create a care plan. We're gonna coordinate that care plan, and we're gonna help navigate you to where you need to go. What we've seen is about 60% of those visits are completed right over the phone. Think of the easy things like sinus infections, pink eyes, maybe flus and colds, where we can create a care plan, write a prescription right over the phone, and make it really easy. And if you need to go in person to a visit, we're gonna help coordinate those visits in a really easy way, and I'll get into that in the benefit summary in just a minute. The prescription management. We're gonna help organize your prescriptions, make sure you get them at the right cost, and like I said, even order them over the phone. And then we're gonna make sure we check in, just like a mom would do. We're gonna check in on that care, make sure you're feeling better, make sure you're doing okay, make sure you got your prescriptions, make sure you're taking them, and make sure you're all right. And then any bills that come. So we understand the healthcare system is so complex, and I'm sure your clients get EOBs or bills today that just don't make any sense. We're here to help with those. So they can just snap a picture, send them in on our app, and the team will make sure that we organize that for them. So let's talk about the benefits now. We're gonna go into the benefit summary. Now remember, accessing the care always starts with contacting us first. And this is a nationwide virtual primary care first visit or healthcare first visit. Think about that idea of a mom with a medical degree. We'd always reach out to our mom first if she was our primary care doctor. So it always starts with contacting us. It's 24/7. You can do it from your home, from your car, from work break, wherever you are. We're gonna collect some information. And then we're gonna have your medical records again right in front of us. We're gonna make sure we organize that visit. We're gonna make sure we follow up with you to make sure you get everything that you need done. And we're always gonna guarantee that we're gonna hire helpful, friendly people that are always gonna be saying please and thank yous. But that virtual primary care visit is going to eliminate probably again about 60% of the in-person visits, meaning there's no claims, there's no cost to those. It makes it really easy. So let's get into the details of the benefit summary. Now remember, this is an ERISA insurance plan. It's for employer groups with 20 or more eligible employees. Not 20 enrolled, but 20 or more eligible employees. Now after you've done that virtual visit, you may need to go in person. And here's the cool thing about this. It's an open network, meaning you can see any doctor nationwide. We do have a network built into it with MultiPlan, but it's also an open network. So your employees that say, hey, am I gonna be able to continue to see my doctor? The answer is yes. Let me go through some of the benefits on the left side of the benefit summary here. Virtual primary care visits, there's no cost to those. Those are always free. And I'm gonna just read through them so you understand. Primary care, urgent care visits, no copays and no deductibles for those. Now people hear that and they say, is that really true? Let me explain why in just a second here. Labs, all the routine labs are free, done at LabCorp. Because the plan is compliant with the ACA, all the things mandated by the Affordable Care Act, colonoscopies, physicals, mammograms, age dependent, those things are all free as well. And then chiropractic office visits, 12 per plan year per member are free, and x-rays are free. And we've also included a telecounseling mental health line that's included at no cost. The key to this, to get these benefits, is that they enter into that Redirect Health system. It's why we gave the context of that mom with a medical degree. That's a big shift for some people, but when they do that, they'll start to see, gosh, my care is just organized, it's coordinated, it's navigated in such an easy way. And then what about prescriptions and the other care? So prescriptions, there's a tiered copay program, right? We use PBM, and there's all the pharmacies nationwide. They can go to any of them. Our team's gonna help make sure we direct them to get the lowest cost always. And the tiered copay program is always a less than. So if it's less than the copay, the member pays the actual cost. And the other care, specialist visits and imaging here. There's a $50 copay for specialist visits and imaging like MRIs, CT scans, PT scans, $50 copay for those as well. And then things like hospitalization, maybe surgeries, babies. You can see the deductible levels. As an individual, it's a $2,000 deductible with a 20% coinsurance and a $4,000 maximum out of pocket. For family or spouse and children tier, it's a $4,000 deductible with a 20% coinsurance and a $6,000 maximum out of pocket. So when you see those, I know you're thinking, well, how do they do this? This price is so low. How are they going to manage this? It's because when you enter into that system first and you have a doctor organizing the care, that's the key, is our TPA, our medical team, we're doctors organizing that care on the front end. And we're going to do that peer-to-peer relationship all the way through. It makes the care streamlined, and when you can get the right care up front, it's always easy to get the right price for that care. And then emergency rooms, there's a copay. It's a $500 copay for emergency rooms with a 20% coinsurance, and that will always go to the maximum out of pocket. All right, so now let's talk about the right side of the benefit summary, which is the employer-sponsored HRA. So there's some things on here where you're gonna see some exclusions, things like specialty pharmacies, organ transplants, kidney failure, skilled nursing, maybe specialty drugs. On the right side of the benefit summary, it talks about an employer-sponsored HRA. Now this is why we've written these things out of our foundational plan, is so that if there's people that need this additional coverage, and if you think about your employer groups, they're probably 5% of the employee population is going to fit into this right side. Either people that have these needs, or they don't want to call us first and they want to self-guide. So you can see the difference of the benefits there. It's things like the primary care visits. Now the member has a $50 responsibility. They would get reimbursed through the employer HRA plan. Or the specialist visits are $100 and they can get reimbursed for the difference through the employer HRA plan. And the exclusions, or where they want to guide or do their own care, you can see the benefits there. This is done by design, because if they follow the plan and they call us first, we're always going to be able to organize that care. And again, the key words here are coordinate, navigate, and the pre-negotiation that we do for the members. All right, so let's tie it all together and how this works. So that, remember, this is an ERISA insurance plan managed by Redirect Health. So it complies with all the ERISA laws, which also means for those employers with 50 more full-time equivalents, it's going to meet Penalty A and the Penalty B rules. Redirect Health, we are hired to manage the program. So you put this insurance plan in place, and then you have Redirect Health in front of it to manage the care. Done this way, it's going to always drive the cost of care down. And what that does for your clients is it gets them out of that cycle of continual high cost renewals year over year over year, where we can control the dollars. Now, before you start, one of the unique things we do, because we're a medical team, is we are going to collect medical information from your client's employees, meaning when they go through enrollment and they sign up, we want to find out which prescriptions are on, who their doctors are that they see, and any conditions that they have, so that we can put them in the programs we have to swarm them with the care, and again, do that coordination and navigation to make sure they get what they need. And the cool thing about it is we have an app they can use 24/7. They can contact us anytime. Then we want them to think about us like we are Uber. You don't think about Uber until you need it. We're the same way. We're going to be right on the phone, just a push of a button to connect with us and make it really easy for them to get the health care that they need. And those, for those that want to self-direct their own care, or for those exclusions, we've created the employer-sponsored HRA plan to take care of all those needs. So let's talk about how claims are paid. It's 5 easy steps you can see here. First, you're always going to start by contacting us. So reach out to us first. We're going to collect some information. Again, we're going to try to do everything virtually over the phone, just like a mom with a medical degree would do. And step 2 is the employee can choose their own provider, or we can help find one for them. Remember, this is an open network. It also has the multi-plan network behind it. In step 3, this is the most important part of the process. This is the peer-to-peer conversation that happens. This is doctors talking to doctors about your client's medical care. It's a much different conversation than an insurance company talking to a doctor. This makes sure that we get the right care every time, and then it's easy to get the right price. And steps 4 and 5 are about the advocacy and the actual payment of the claims. Now remember, only claims where the member initiates contact with us first are benefits on the plan. We do all the pre-negotiation. That's a big piece about what we do. There's lots of companies that come in on the back end and they'll negotiate claims after things have happened. We do all that on the front end, right? Because we're doctors. A lot of times we're the doctors ordering the care. It makes it really easy to get the right price, and then we're leveraging time of service payment, meaning we're paying the claim the day that the surgery or the procedure happens. Makes it really easy to get the right price and save that money. So a lot of times we get asked, what happens on this plan if there's a serious medical condition? Now there's rarely one pathway when something serious happens, so we've created this second opinion program. And what we do is there's 3 easy steps. It rarely just impacts me alone. It's going to impact my whole family, maybe my brothers and sisters, mom and dad, family, friends. I can get anybody that I want involved with this process, and here's what we do. There's a preparation piece, there's a discovery piece, and then a decision-making piece. When we do it that way, it's really easy to streamline those serious conditions. We get 2 things done that way. We get the right care, and everybody's involved in that decision-making, and then it's easy to make sure we get the right price then. Now, as an advisor, you're probably starting to think about clients who this might be a good fit for, and you're ready to start selling it. So here's some technology pieces that we have that help make it easy for you to sell. The first is a broker portal. So we'll create an online store for you to make it really easy to submit your cases, do all the enrollments online. There's API, there's a lot of things designed to make it really streamlined. The other piece that does is it plugs it right into our system. Remember, we're the medical team that's going to take care of these employees after they sign up. By doing it that way, it puts it right into that system. And also our quoting tool. Online, it's very simple. You type some information in, you can get an easy quote that you can send right to your clients. And this is very powerful because they're going to be able to compare where they're at today and where they're going to be at with our plan, and often the benefits are even much better, even with the premium savings. Okay, so here's the broker journey broken down to 6 easy steps. First is the introduction to Redirect Health. It could be today. We could even set up a more in-depth webinar so you can ask questions and learn about it. Step 2 is schedule a webinar and a demo. So you can see the broker portal, you can see our employer application, our enrollment process, get a quote done, and then see any videos that would help you. Step 3, apply to get appointed with Redirect Health. Really easy process, very simple. You go online, fill out some paperwork, and then step 4 is going to be you're going to sign the contract. Step 5 is receive your custom broker portal. This is your online store where now you can submit employer applications, see eligible employees, and do ads and drops and things like that. And then step 6 is the ongoing support. So we have a team that's here to support you with sales, administration, and then once your clients get signed up. All right, so just as a reminder, Redirect Health, we're a medically managed healthcare company. We have our own TPA. We've made it really easy to seamlessly integrate everything. Now, if you look at your clients and you go, how do I enroll my clients? How do I enroll their employees? We have our own technology that does it, but if you prefer to use a Ben admin system, we can integrate those as well to make it really easy for you if you're familiar with those things. And commissions. So commission is a flat 6% rate. One of the things we've seen with this plan is because it's so attractive, you're going to get a higher adoption rate, meaning more employees are going to take the plan and you're going to get more employees adding their dependents as well. Okay, so what's next? Now, we've made it really easy with our own TPA. We've got our own medically managed healthcare company, and the financial transparency that we give you into invoicing, the eligible employees, the commission payments are done fast, and also the seamless enrollment. Now remember, we have our own enrollment that automates everything, or if you want to use your Ben admin system, there's that API we have that can connect all that, and then the renewal. So once you get your clients signed up, the renewals are so easy. We've got account managers, or we call them client success advocates, that will be assigned to you just to help you throughout the year with anything that comes up. And then when the plan renews the next year, we make it really easy for your clients to stay on the plan. All right, so thanks so much for taking the time today to learn about our Kick Healthcare plan. And the next steps are this. We made it really easy. Go to redirecthealth.com/broker-appointment. That's where you can get appointed and start selling. And we sure look forward to helping you. You're going to be able to ask some questions now, and we look forward to talking to you. Thanks.